How to apply a resting hand splint for patients with acute burns or skin grafting to the hand. You will need 1 to 2 rolls of Kerlix padding, a 4-inch ace wrap, and clear plastic tape. The splint and padding will be applied over dressings. The dressings may be different than the ones shown here. Fold the Kerlix in half and start by wrapping around the thumb. Allow padding to unfold as you wrap around the wrist. Wrap down the forearm past where the splint will end. Make sure the thumb is free to move. Do not span padding between the thumb and fingers, as this will make it so the splint does not sit properly against the hand. The space between the thumb and fingers should be covered, but avoid excessive bulk that will shift the splint. Bring padding just past the end of the fingertips. You may need all or part of a second roll of Kerlix, depending on the size of the patient. Apply the splint. Use light pressure to make sure the wrist and web space have full contact with the splint. Hold in place with an elastic bandage starting at the wrist. Use light tension, just enough tension to take out the slack. Secure the bottom edge of the splint with the ace wrap. Wrap back up to the hand. Wrap around the thumb separately, and then wrap the fingers, covering the fingertips. The fingers should be resting against the splint. Secure in place with long strips of clear plastic tape. Avoid using the metal clips. Ask how the splint feels and adjust as needed. Follow the wear schedule provided by your therapist.